Although it does not share the homology with the CDK inhibitors such as CYP family or info family. 14-3 sigma, we will talk about a little bit. This particular protein or gene also induced by p53. Okay, remember p53. When you read a lot of papers, they always talk about p53. p53 is mutated or deleted in many types of cancer, including lung cancer. Usually, a lot of lung cancer patients have p53 mutation. In colon cancer, a lot of p53 mutation. Okay. Lung cancer. Talking about lung cancer, a lot of etiology show that there's also EGFR mutation, etc. Okay. And talk about lung cancer, I would like to take this opportunity to emphasize that smoking, as we know, is very critical in causing lung cancer. Okay. I want to take this opportunity to ask, okay, how many of students here are non-smoker, meaning you don't smoke? Raise your hand. Show me your hand. Good. But I didn't see everybody raise hand. So those of you who don't raise hand, you are smoking? Okay. Be careful, as we know. Okay. Good. For those of you who don't smoke, please continue to do so, because smoking is such an important factor in causing many different types of cancer, not just lung cancer. Okay. You name it. You have impact on gastric cancer, bladder cancer, colon cancer. Okay? The first thing right now, the doctor see a patient, after doing all the treatment, after the guy or the patient got diagnosis with cancer, the first thing doctor will ask the patient to not to do is, if you are a smoker, please stop smoking. Okay? Smoking is such a bad thing. And epidemiology also shows us for those smokers, they will lost 10 years of their life. Okay, compared with those non-smokers. So I here give out a very important advice to a young student here. If you are a female student, you are looking for the future nice gentleman to marry, first thing to make sure the guy is not a smoker, okay? Because if he is a smoker, he's going to lose 10 years of his life. He could not give you that 10 years, so be very selective. For the guy, I just want to let you know as well, if the message right now go out, if you're a smoker, please stop smoking now. Because if you don't stop smoking, you probably couldn't find a decent girl to marry. Okay? So remember, smoking, as we know, epidemiology is already shown very clearly. And every time I come back to Asia, I'm originally from Taiwan. And as we know, all the Asian countries smoking a lot. Okay? Even the United States, in the past, they estimate 20 years ago, about 70% of males smoking. Okay? But in recent years, the smoking population dramatically decreased because everybody knows the cause of the smoking. Okay? But in Asia, we didn't do that much enough yet to advocate the best thing about smoking. Okay? So I really encourage many of you here, if you know you have friends or relatives, they are smokers, you help them stop smoking. Okay? And I always think that if we could do something about smoking, we could actually save a lot of people's life. Okay? I have never seen any country, including the United States, any government say, from now on, I know tobacco use is bad for people's health. Now, no more tobacco selling. None of the country have ever done that. But if any one of you become Minister of Health, please do so. Stop smoking. Stop selling the tobacco in this country. And you will help a lot of people, okay? Because I always like this story because we recently, our MD Anderson Cancer Center has a stop smoking policy, okay? Anybody want to come to MD Anderson to work, including apply a job as a full professor, associate professor, or even a cleaning lady, the janitor, or electrician. Now, start from next year, our policy is, if you are a smoker, sorry, we cannot hire you, including even you as a full professor. So I think that's a very, very important message out for the people who are smoking. This will be the first hospital in the whole United States to do so. Okay? And I'm sure the rest of the hospital in the United States will follow, and then the whole world will follow. So this is just to emphasize how important to have this message out for those people who are still smoking. I think for your own health, for your family, for your loved one's health, we should stop smoking. Okay? Please. For cycling CDK, we'd like to share with you about how INC4 family members could stop the cycling CDK activity. Okay? These was done through the structural biologists. So structural biology using X-ray crystallography to determine the structure of the whole complex, allow us to understand these cycling CDK, how they got inhibited by these important CDK inhibitors. So what INC4 family has done is by a competition process. So as you can see here, there's a cyclin D CDK for cyclin D complex. They are very active form. But CDK4 will be competed by INC4 family. Okay, as you can see here, the close crystal structure of the P16, which is INC4A, with the CDK6, or could be CDK4 as well. By this competition, cyclin D is lefting along, it's left along, and then cyclin D CDK4 is no longer binding to cyclin, thereby inhibiting the cyclin D CDK4 activity. So this is the way of mechanism that the INC4 family could do to inhibit the cyclin CDK activity. As for the CYP family, they are a little bit different. They are not going through the competition process. They just direct bind to the cyclin CDK and then block the entry of CDK substrate. As you can see here, cyclin CDK here. CDK2 is the left-hand side, cyclin A is the right-hand side. You see those red little loop there? These are the CDK site for the substrate to enter the crack of the CDK catalytic domain. Okay? So what P27 does is what binds to the complex. The P27 actually extends the part of the nucleotide, the peptide at the N terminal into that substrate entry site. So sort of block that substrate entry site. The cyclin CDK could no longer find any substrate to phosphorate, thereby inhibiting the cyclin CDK activity. And as I said earlier, these are the negative regulator of cell cycle. And then we mentioned earlier, cancer is a disease of cell cycle. So the brake system possibly becomes deregulated during tumorigenesis. At the beginning, we think it may be a mutation or deletion in some of these CDK inhibitors. And after looking so hard, only P15 or P16 could have the mutation. Others do not have the mutation. As you can see here, the localization of the P15 and P16, they are located 9P21. Okay? P27, P21, P57 are at a different location. Interesting enough, when the scientists looking for the mutation, just like we're looking for PPD3 mutation or deletion in the cancer cell. As I said earlier, PPD3 is mutated or deleted in more than 50% of the cancer. But for P21 or P27 or P57, the deletion or mutation was not that popular. In the end, we find out the defect is not at the gene itself. It is at the protein level, post-transcriptional level. We will talk about that later. Okay? So these CDK inhibitors actually receive a lot of signal, or they have a positive regulator or negative regulator of these different cyclic CDK inhibitors. For example, there's a negative regulator of P16 coming from mixed signal, coming from promoter methylation, and could be coming from deletion mutation, as we talked about earlier. MYC is a transcription factor. Many of you know that it's very important gene product. We sometimes call it proto-oncogene. Proto-oncogene meaning that in a normal cell, we still need a particular gene for biological function. But sometimes, when the normal cell becomes cancer type, these type of gene products become deregulated. They promote cell proliferation against apoptosis, promote cell metabolism of cell, etc. So become deregulated. This type of gene product, originally we still need it, but when become cancer types, it's become one type of oncogene, so we call it proto-oncogene. The proto-oncogene, MYC, when it's